on? You look like you're in pain.
Oh, my toe just hurts. The joints are really stiff. It's feeling a lot of pain.
Maybe we should go to the doctor.
Do you mind taking me?
Sure, let's go. How could you let this get so bad? You're supposed to be in nursing school. You're supposed to know these things.
I just thought I could deal with it. I just
Well,
didn't think it was much. But it just gets worse and worse.
Are you okay?
I'm gonna take a seat.
You don't look so good.
It hurts really bad.
Don't you think you need to go to the ER?
It's my toe. Yeah.
Come on, let's go.
Just give me a second.
Oh my God, oh my God. Oh my God, he's dying. He needs a doctor. Please help, please help.
Hello, what seems to be the problem today?
Hey Doc, my toe is killing me.
Can I take a look at it, see what's going on?
Yeah.
What is that?
I don't know, it just hurts really bad.
And how long has this been hurting for?
It kind of off and on, like the past couple weeks.
All right, let me see it. Okay, looks like you may have a serious case of gout.
What's gout?
Cal, we went over this in Dr. Weaver's class. You don't remember?
Did we?
Okay, class. Today we're going to be talking about gout, if you will. Gout is a form of arthritis characterized by severe pain, redness, and tenderness in your joints. Pain and inflammation can occur when there is too much uric acid, crystallization, and deposits in the joints. Some symptoms of gout include severe pain, redness, and swelling in your joints, often your big toe, and attacks come suddenly and often at night. So the drug that we're going to use to treat gout is allopurinol. Its use is that it treats gout, of course, or kidney stones. It's also used to decrease levels of uric acid in people who are receiving cancer treatment. And a few causes of gout are increased stress, thank you Dr. Weaver, excess alcohol, red meat, seafood, sugary drinks, and high blood pressure. I'm going to say it again. Causes of gout: increased stress, excessive alcohol, red meat, seafood, sugary drinks, and high blood pressure. Now class, why am I saying it over and over again? Because it's on your quiz, if you will. Wow, sleeping again.
Alright, so we're going to do some tests to figure out what's going on. So what I'm going to need to do is I'm going to need to take a urine sample and we'll have to draw some bloods.
Okay.
Okay? Alright, so your lab results have come back and they show an increase in uric acid in your urine, which is a common indicator of gout. So I will be putting you on the drug allopurinol.
What's that?
It's an anti-gout agent and it works as a xanthine oxidase inhibitor. So what it does is once it's in your system and it's metabolized by your liver, it turns into oxypurinol, which is its active form. So once the oxypurinol acts as an inhibitor of the xanthine oxidase enzyme, this enzyme converts the hypoxanthine to xanthine, which then xanthine turns into uric acid. So the inhibition of this enzyme by the drug will decrease the production of uric acid, which also decreases the symptoms of gout. We will start off by putting you on a 200 milligram tablet, but if we need to increase or change the route of administration to an injection, we can also do that.
Okay.
And I will also be referring you to a urologist of the hospital so you can make any follow-up appointments and labs done.
Okay. Thank you, Doc.
You're welcome. If you have any questions, please let me or your nurse know.
Alrighty, I will.
Hey, Courtney.
Hi, doctor.
So my patient in room 2, I've just put him on the allopurinol, 200 milligrams for his gout. So I was wondering if you could keep an eye on him and if he has any questions, help him out. But I also need you to monitor his lab values such as AST, AOT, hemoglobin, hematocrit, platelets, and WBCs.
Okay, I'll put that in the computer right now.
Okay, thank you.
Hello?
Hey nurse.
Yes, what is it?
I just have a few questions about the medicine the doctor prescribed me.
Okay. You want me to come to your room really quick?
Yes, if you don't mind.
Okay, I'll be there in just a second.
Okay, thank you.
All right, bye.
Come here.
Hi, Cal. I'm your nurse for today. I heard you have a few questions about the drug allopurinol you're being put on.
Yeah, the doctor came in earlier, but she was saying a bunch of big words I just really didn't understand.
Okay, so what were your questions?
I just kind of wanted to know, like, how long the drug would work and, like, when did it start working.
Okay, so the pharmacokinetics of the drug. So your half-life is going to be 1 to 2 hours. It'll probably start working after 1.5 hours of you taking it, and you'll probably have the effects for about 1 to 2 weeks. And it's going to be metabolized in your liver and excreted through your kidneys.
Okay.
And while I'm in here, I'm going to go ahead and give you some more information. So while you're on this drug, you do not need to take amoxicillin or ampicillin because they could increase the possibility of you forming a rash. And also try to avoid anticoagulants because they'll increase the anticoagulant effect.
Okay.
And then just some basic patient teaching. Try to drink plenty of fluids while you're on this drug and try to avoid alcohol.
Spring break's next week, though.
I know, but it's what you gotta do. And try to stop this drug if you develop a rash. And then it could cause drowsiness, so just don't do any hazardous activities or work machinery while you're on this drug.
Okay.
Did that answer all your questions?
I think so.
All right.
If I have any more, I'll let you know.
All right.
Nurse?
Oh, hi.
Hey, I'm over here in this bed next to his, and I overheard you talking about some drug that can help with flare-ups in the toe.
Mm-hmm.
And I think I have that same thing. Do you think I can get on the same drug?
Well, if you're referring to gout, women are not as likely to receive the drug allopurinol. And since you're especially pregnant, we usually don't give this to pregnant women unless it's absolutely necessary because it can go in your breast milk and potentially harm your baby. So you would probably need a doctor's evaluation for that.
Well, what doctor could I go talk to then?
Dr. Maya?
Okay. Can you give me her number?
Sure, of course.
Okay, thanks.
Allopurinol has been found to be the most common cause of Stevens-Johnson syndrome. This is a severe skin rash that is characterized by itchy hives, red or purple colored spots, scaly skin, fever, chills, trouble breathing, or swelling in your face or throat. Upon finding these symptoms, you should call your physician and discontinue the medication immediately. Stop it. Get some help. Patients can experience symptoms such as nausea and diarrhea. Allopurinol can lead to liver injury due to being the site at where this drug is metabolized. This can lead to tiredness, lack of appetite, weight loss, right upper abdominal pain, and jaundice. This drug may also cause you to become drowsy. You shouldn't drive or use machinery or do other tasks that require alertness until you know how it affects you.
Hey, Courtney.
Hey, Cal.
How are you doing?
I'm doing good. Did you get your problem fixed?
I did. They put me on allopurinol like 2 weeks ago, and I feel so much better.
That is so great. Well, I just want to check on you.
Well, thanks so much.
All right. Have a good day.
Hello. I just want to say this drug has made a huge impact in my life. It has not only made my life easier, but has allowed me to do things I never thought I'd be able to do again. So if you too are suffering from gout, I highly recommend the drug Allopurinol. Thank y'all. I hope y'all have a wonderful day.